Welcome to the special edition of Faces of Digital Health. In this episode, we're going to discuss healthcare and healthcare innovation in the US and Europe, as I had the pleasure to talk to Jody Tropeano, Head of Content at Health US, and Henry Stoneley, Head of UK and Netherlands for Health Europe. Go downstairs on the stairs. Jody and Henry, thank you so much for joining me today to discuss basically healthcare and healthcare innovation in the US and in Europe. How do they compare and how all this can be combined, the knowledge that you have, in basically bringing something new to the European space. Jody, I want to start with you. You've been the head of content at Health for the last 5 years. And in your role, you really need to know everything that's going on in healthcare to decide what's going to be on stage. So thinking back on the last 5 years, what are some of your observations? How do you see that healthcare in the US has been evolving?
Yeah, so it's been a very eventful 6 years. I think the pace of innovation and acceleration of digital health has really, I think, I don't have the official chart, but I'm sure it's up and to the right all the way. Thinking back to even the topic of telehealth that we know boomed during the pandemic, we did our first session on telehealth in 2019. And we just did one little panel discussion at the event, and we had to kick people out of the room. I mean, they were just flooding in. You can tell the huge amount of interest in this budding topic. And then cut to a few months later, the pandemic happens, and now, I mean, it's all that anyone talks about. And it's fizzled a little since, but I've noticed that with a lot of topics. They kind of come and go, like digital therapeutics, which I know is a big topic in the EU. It's not so much on the top of people's minds in the US anymore. So for our agenda, we try to cover kind of what's coming up next, but we don't want to fall into the hype cycle trend, if that makes sense. Mm-hmm. So we try to take a neutral stance on a lot of these topics, but then also follow where our attendees are going. So the sessions that over the years are kind of tried and true, consumerism within healthcare, we've been covering that since 2018 when everyone was asking, what is Amazon going to do in healthcare, to 2023 when we kind of know what Amazon is doing in healthcare, but we still want to hear from them and their strategy. So that's been a really strong topic over the years. Another has been AI. So generative AI is obviously a new thing, but AI in healthcare has been spoken about for probably the past decade or so. So it's just the use cases have changed and the technology has gotten better. So we just try to follow that trend and where the use cases are, and also the regulatory side of things, so how they're regulating this fast-growing technology. So I know that's probably broad, but I would say we follow our attendees. We track what sessions they go to. We see what sticks. We try new things every year. We did a sexual health session in 2022. Was not popular, so cut that for the following year. It wasn't, I know. It's, I think there's these niche topics that there's so much cool innovation happening, but it doesn't impact the majority of our attendees. So we have to do a certain number of those and try out new things. But I think sticking to the tried and true topics, the big themes, things like consumerism, things like the boom of Medicare Advantage in the US, like those are always going to be popular. So we do just a nice mix of the tried and true and the budding topics, see what sticks, and just keep iterating the agenda every single year.
You mentioned that the digital therapeutics aren't an interesting topic, or not at least as interesting topic, which I actually wanted to ask you about, because I remember a session at Health 2022 about DTX, and everybody was so fascinated by everything that's happening in Germany, how great framework they've designed, how basically at the forefront of innovation Germany is, and basically also there was a lot of disappointment that the US still doesn't have a reimbursement code for digital therapeutics. And especially, I guess, DTX were, at least to me, a topic that seemed as a really big thing inside digital health. But in 2023, with the bankruptcy of Peer Therapeutics and also a lot of challenges in Europe, that excitement, I guess, is boiling down a bit. So how do you feel about where the biggest excitement is at the moment in the US?
And I find digital therapeutics fascinating. I think I'm upset that it hasn't taken, and I think you hit the nail on the head with the reimbursement code, and that's why. And I think that often happens. We get this new idea, everyone is so excited for how this may change the industry, and then you realize after a certain number of years how hard the US healthcare system is, and you kind of hit that wall. And then it's like, okay, back to the drawing board. This didn't really work here. So anyway, just wanted to clarify. I like digital therapeutics. I use a few of them, yeah. So I think generative AI, I mean, I have to pick that topic. It's, who knows what the future holds. It's moving so fast. And I know there's a lot of fear around using it in a clinical context, but I think we're several years away from that happening. But I think the real hope is where it can help clinicians now do their jobs better, be able to spend more time with patients, spend less time documenting on the administrative tasks, and it's already helping in that respect. So that's what I'm most excited about, because we have a huge workforce shortage right now in the US, and if this technology can help and make the practice of healthcare better and make physicians love their jobs more, then I think that's a huge win for the industry.
Perhaps a few interesting stats on the topic of generative AI. I was also trying to get my head around, where are we with AI in 2023? And basically, if we look at the Gallup growth reports, 39% of digital health startups use some form of AI, but only 2% of those startups actually use generative AI. So I think that kind of makes it very clear that we're still in the very early stages, but at the same time, yes, there's a lot of optimism because of the improvements that basically this is bringing, especially in the administrative burden. Henry, Europe is obviously completely different from the US, different problems, different regulation, different cultures. So what's your favorite language in Europe?
Great question. Dutch. No, like.
Do you speak Dutch?
I speak terrible Dutch, and I won't be doing it on camera.
It's better than not speaking any Dutch.
Yeah, I guess I'm the head of UK and Netherlands. I've got to speak a little bit. Everything we do is in English. It just makes perfect sense for us to do that. So.
Health is coming to Europe in June. You obviously had to do a lot of research in terms of which topics are going to be on stage. Can you talk a bit about the whole research process that you did and what you uncovered? You've been in healthcare even before your current role, so what was potentially new for you? What do you see as the most interesting things that you discovered?
I think health is obviously a wide ecosystem of that, right? Like we cover absolutely everything from government through to patients, so everything in between, so pharma, life sciences, health tech, VCs, payers, providers, insurance, etc. And so when we are doing the research, it's important that we speak to absolutely everyone. So Lena Burns, who's our head of content in Europe, and I spent the summer talking to pretty much everyone we could get our hands on. And that might have been patient advocates, or it might be health ministers, or leads of pharma companies, whoever it was, to find out what they're talking about behind closed doors. So we spent the whole summer talking to hundreds of people for hours and hours who really generously gave us their time. And then we built an agenda from the ground up. And in doing that, we've been able to talk about topics that I previously had a very high level knowledge of, superficial knowledge of. And
For example?
DTX is a really good example of that, in that I had read a couple of reports on DTX. As a freelancer, I'd worked with one DTX company based out of India. but I don't use any like Jody does. I had considered it when it started to become very hyped up in like 2018, 2019, a little bit of a hype train, like you were saying, about what we try and avoid. And so I'd not done too much digging into it. So actually it was fascinating to kind of be looking at how DIGA is working, how DAA in Austria is working, and the M-House Belgium pyramid, or whatever they've called it. That was one of them. But there are loads of topics that are dear to my heart, to Lena's heart, to other people in health's heart that we have to cut because we don't base it on our own kind of feelings. It's not based on, what I want to talk about. I would love to be able to get 5 incredible people there to talk about workforce management programs, but actually that's not something that brings everyone else there. So it's a big, big research project over the summer.
So which topic do you think is going to be the biggest, or is the biggest at the moment?
Gen AI is always going to be a big thing. And I think that what I want to do with our AI content, and what Lena wants to do with our AI content, is to make sure that we're actually talking about the right things and it's not just generic. I think some of the stuff that I've seen recently about Gen AI is very exciting, lots of hype cycle stuff, but we're ignoring the really boring stuff, the unsexy stuff. Yep. So if you look at like UMC Groningen in the Netherlands, they are literally using GPT to answer patient queries online, and now they're using it to summarize patient records, so that instead of having to read 14, 15 pages of like, let's say an octogenarian patient's kind of cardiac history, you can just get a 300-word summary. But there is risk attached to that, but they're trialing it at the moment. That's not sexy, that's not exciting at all, but it's incredibly important and incredibly practical and amazingly, an amazingly prescient use of technology. So I want to make sure that, yes, we will talk about the super exciting stuff and how this could transform care and, the elderly and care at home and things like that. But also let's talk about the less exciting things, because those are the things that someone can come to health and be like, look, if one hospital in the Netherlands can do that, can I take that back to Austria? Can I take it back to the US? Can we do it in Norway?
What do you think that people will say on stage that they told you on your calls? Because I had panels where I, had prep calls and people said, amazing stuff, really deep insights or opinions that they had that were really appealing, but then on stage, everybody gets very diplomatic, you're on the record, so the whole attitude changes.
They're looking at their head of comms in the front row.
Yeah.
If we go back to healthcare in Europe, what do you see as the most pressing issues at the moment?
I think if you look at the aging population in Europe, the creaking public health systems are public health systems the future of European healthcare? And then
By ours, you mean UK?
I mean across Europe. Obviously, we have 30 different models across Europe for how healthcare is delivered. But broadly, they're all public. If we have government involvement in healthcare, what does that look like over the next 10 years, 20 years, as Europe's kind of economies are struggling somewhat? And then you have to look at the workforce shortage. Globally, WHO thinks we'll have a 10 million healthcare employee shortage by 2030. And whilst that massively impacts the poorer countries in the world, it also impacts Europe, it impacts the States, and we're not sleepwalking into a bit of a snowstorm, but I think until the last couple of years there's been a reluctance to say, okay, actually we need to reconfigure how we deliver healthcare in order to make that a sustainable model, because otherwise you just let it kind of crash.
Great queue for so many questions. In Europe, one of the great points that I heard at one of the conferences this year was that basically because we have the free flow of the workforce inside the EU, it's very easy for large countries such as Germany to give great offers to doctors from other countries. So not only do you have the brain drain, from low or middle income countries to come to Europe, even inside of Europe, there's this kind of battle for the workforce. But maybe to leave that alone.
I feel like I probably shouldn't be recorded talking about Brexit. Yeah.
Go ahead.
No, absolutely not. I'd really like to keep my job.
Okay, one topic that basically is trying to address better management of healthcare and healthcare costs is also value-based care. So maybe, Jody, what kind of trends do you see in there?
Yeah, so it's a topic that we've been speaking about at Health since the very beginning. It's been around a long time. I think CMMI, which is part of CMS at HHS, they've been around for over 10 years now, and we actually just had a session about this at Health. Kind of, is CMI, are they reaching the goals that they set out to reach? And I think the consensus on the panel was no, but they need to keep trying because this is too important to give up now. But I think value-based care, we're seeing a lot in the specialty care space. So value-based care for oncology or for MSK or for gastroenterology. I think it's really doing well in those smaller patient populations. But the challenge is to figure out how to scale this across all health systems and anywhere you receive care. And I think I did a poll in the office just asking anyone in their experience with the healthcare system, have you ever experienced anything but fee-for-service? And it was a resounding no. So most people are not reaping the benefits of value-based care, but again, we need to keep trying. We need to keep trying new models. And eventually, I think we'll get there, but the U.S. healthcare payment system is pretty broken, as we know. So it may take another decade or two. Yeah, not too bullish on the near future.
Did you want to add something?
No, not at all.
How do you see value-based care in Europe?
For me, the conversation that needs to take place with value-based healthcare is a really high level. I see it as not just a method to get to care, but also as an entire framework for a health system. This is how you structure, how you confine our system to say that everything should be value-based. And the conversation that has to happen in every country in Europe, and Europe more broadly, is that the way that we are going to go? And I don't think we are likely to have that conversation anytime soon. So the issues that Jody's outlined in the US are pretty similar, even if you take up the payer aspect.
But maybe there's some situations where fee-for-service will still make sense. So maybe we're not going 100% to value-based care, but I can see a world where it's a hybrid model. Yeah. But I agree. It needs to be high-level discussion because we're not quite there with the mechanics of it yet.
Jody, I don't know to which extent you're familiar with the European healthcare system, but I'm kind of curious to know, where do you see that the US healthcare system is very strong, and what are some of the lessons that might be good to adopt in Europe?
Yeah, I mean, I don't know that much about the European healthcare system.
Are you coming to Health Europe?
I am going to be there with a notebook, sitting in as many sessions as I can. But I would say the one benefit of our system is our ability to get appointments quickly. Again, this depends on where you live in the United States. Rural healthcare and urban healthcare are very different. But let's take me for example. I live in New York City. I hurt my back last week. I needed a quick orthopedic appointment to make sure I didn't herniate a disc before I flew 12 hours to Slovenia. I was able to get an appointment the next day with a very qualified orthopedist, walking distance to my office. I mean, that's pretty amazing when you think about it. So I think we take that for granted a bit in the US. And then Henry and I were just talking about this at lunch, just the stress on preventative health. He thinks we're doing way better than Europe. I would argue we're not doing well at all, but maybe we are doing better.
So where do you think that you're doing great, and where do you think they're not or we're not?
I would say and I think the Biden administration has done a great job stressing the importance of mental health. I think we've come such a long way, even just the past 5 years, on making sure that mental health is a part of every conversation when we're talking about our general health. We can't separate them. They have to be connected. And emphasis on youth mental health, because we have a huge ballooning crisis in the US. And I see a lot of strides being made, and I'm hopeful of the future because I don't think we're ignoring the issue like we may have been in the past anymore.
And youth mental health in particular, there was an article on the BBC a couple of weeks ago about undiagnosed mental health conditions in under fives. And it's like something like, don't quote me on this, but close to 1 million under fives with some form of mental health condition that we're just not getting them to at the moment. So that's a really good example. It's hard to compare all of Europe to the US because there are systems that do certain things amazingly, and there are systems that do other things amazingly. no health system anywhere in the world, let alone Europe, is ever going to be perfect, where you might be brilliant at doing preventative healthcare and screening programs for cancer and all sorts of other things. You might have lesser budget for other areas. So it's hard to compare Europe as a homogenous mass to the US, but I do think that because of the model that is employed in the US, there is a higher emphasis on ensuring that people are, well, let's be very clear, there's a big gap between the levels of provision anywhere in the world. There is a growing gap between rural and underserved communities and urban communities and the wealthiest and the poorest. It's very hard, again, to generalize. However, some of the stuff that the US does really well, in my opinion, is that preventive. It's the screening programs that we do in Europe reasonably well, but because we're not, generally speaking, we have hybrid models, we're not purely insurance-based. There's less of an incentive, I think, often for those things to happen. Now, that's improving. You look at private health plans, and I have a UK-based one that incentivizes me to buy an Apple Watch, which I still need to do, and various other things. It is changing, but I think we could do more in Europe. And I feel like there is a lot more, I feel like you guys have more ownership of your own health.
Yeah.
Can I throw a controversial thought out there? So I've been thinking about this for the last few days, and we always complain that healthcare is too much of a sick care system where something's wrong and you go see a doctor, and that basically the model should be reversed. Now, what that causes is that you have people that have time to deal with their health, that have enough resources to actually have that among their primary concerns, starting to consume healthcare resources. I'm going to be a bit, like one of the critiques with the forward health care pods was that basically their client base is between 20 and 30 years old on average, and that's where you basically don't necessarily have serious issues. I'm not saying that it's not good, for people to be mindful of their health, but when we talk about workforce shortages, they do consume doctors' resources. You've got doctors that are going to be looking at more healthy people than maybe those that don't even get to there. So what are your thoughts about that, the whole wellness and prevention emphasis, which is especially strong in the US? And I think it's awesome. I think it's great that, when you come to the hospital, that you actually feel comfortable, not anxious, just because the surroundings are designed in a thoughtful, patient-centric, user-centric manner. But I am wondering to which extent we are, maybe not looking at all the aspects of this.
Yeah, I think you're trying to say, and I would echo this, we're catering to the worried well a bit. Yeah, we talk about this a lot. Actually, my team, we talk about this a lot. I think that's okay, though, because I think as long as we're not ignoring underserved communities, and I think there was a session at Health about this, getting back to the basics and impact investing, and we spoke about this a little bit before. Yeah. It's easy to look at the forward care pods, which are very cool, and if they help, wonderful, power to them, and want to invest as an investor in that sexy company that's going to make big headlines. But I think there needs to be a balance of that and investing in innovation that's catering to the Medicaid space, for example. And as long as we're doing that as well, I think it's okay that companies like Forward get funding and try new things. We need to be trying new things and innovating. And I think the more companies that enter the space, especially on the direct-to-consumer side, it's going to drive the cost down, and then maybe there won't be so much of a digital divide where only the 1% can access a lot of these D2C solutions.
The thing that no one really likes talking about, because it's a really uncomfortable truth, is that while we still operate for health tech, a predominantly VC-based model in Europe and the US, VCs want returns. Like, they might be the most altruistic, wonderful human beings in the world and have a fund that's backed by incredible LPs who have the world's good at heart, but they still want returns. And actually the things that will get the best returns are very often the things that go to the worried well. But what that means is that because these people have the time and the income to support those companies and get them to a level of profitability, or they go public or whatever, once those companies have done that, then they have the resource to push into rural communities, to underserved communities. It's a really uncomfortable thing to talk about, because you're essentially saying, everyone has to wait for it to be applicable across the board, but that's the only way that health tech is going to work realistically, unless someone can identify a problem that is across a huge population and is easily solvable using technology. The worried well are going to essentially help to push that technology to a wider and less worried well group of people.
Jody, health is basically all about innovation, showcasing the latest new approaches to care, new topics. If I just mention a few, we talked about well-being, so there's longevity, there's psychedelics, which in my impression is not discussed in Europe at all on as broad level as it is in the US. But what you're also doing is basically focusing on nurses, focusing on patients, and I want to hear from you if you have any stories that maybe touched you, that you heard from the patients at health, basically, because there's this two worlds that collide. On the one hand, you've got all these innovations that are potentially not even in the clinical practice yet, and you can get very inspired by that, but then you get into the healthcare system and the experience is anything but as exciting as what you see. So what are some of the patient stories that you saw that maybe gave you another food for thought around where the biggest problems in healthcare still are?
I would say I have to mention in the maternal care space, because I think that's an area where we're really failing patients in the US. We have one of the worst maternal health outcomes in any the worst in any developed nation, which is crazy when you think about, like I said before, the level of access we have. So there was, and this actually came from a company it's a technology company that had a whole maternal health initiative that they started that was super simple, just giving women blood pressure cuffs when they are sent home from the hospital after having a baby. And the reason they started it was because the woman who did start this initiative, her sister, I believe, was in the hospital. She was not feeling well. I don't know how much you know, but usually it's 2 nights in the hospital. That's all they give you. And then they send you packing with your newborn to figure it out. There's no care for you afterwards. Once the baby is out, they kind of don't care about you anymore. The focus is on the child, which is very unfortunate. And she wasn't feeling well in the hospital. They ignored her. She was a Black woman as well, which they have the worst maternal health outcomes of any group. So she was ignored, which is, the history of racism in our health system is very apparent, and that's a good example of it. Black women often being ignored for their symptoms. So she went home still feeling this way. She had extremely high blood pressure, and she ended up passing out within that week after she got discharged, and she got readmitted to the hospital, and she was in the ICU for several days because her blood pressure spiked so high. She almost lost her life because of it, when all it took was someone to listen to her while she was there. Maybe she needed a few extra days in the hospital, but really all she needed was someone to send her home with a blood pressure cuff and send her home with some instructions of what to look for, what symptoms to look for, or to realize that she had preeclampsia, which is often underdiagnosed. So that story, I think, is good because it happens to so many women, and it's still happening, and we have the tools to solve the problem. We just are not doing it. I think Biden, again, he just signed the Women's Health Initiative. So that's very hopeful, and I think he, as well as the industry, is putting a huge emphasis on maternal health and women's health. And I'm hopeful for the future that no woman has to lose her life. When we have the tools to identify problems. So hopefully I didn't butcher that story, but all of the stories about childbirth always pull at my heartstrings the most. I do want to try to get pregnant next year, and even me, I have great access. I'm very knowledgeable of the healthcare system. I'm terrified of what could happen because I hear all of these stories all the time, and I hope that my kids one day don't feel the same Yeah.
Yeah.
But from my side, while Jody's having to think about hers, I saw someone called Lucy Young, who's the CEO of a company called Charco, who has created, and I'm no scientist, but a device that sits on your sternum and oscillates. And it's for people with Parkinson's. And she, when I saw her speak, a guy came out with her who could barely get to his stool. And then they switched the device on, and then he spoke a little bit at the end. It was like, seeing healthcare or health tech in action like that, those are the patient moments for me that are most impactful. We can definitely cut all of that because I'm not even sure I got her name right, but yeah.
Yeah, it's women's health is a broad spectrum. I actually spoke at Health 2023 with the investor Leslie Schrock, who's basically investing a lot in the fertility space. So when I was doing the research, I was actually quite shocked to see that basically one IVF cycle costs $12,000 US. You usually need more in Europe. It differs from countries, but in many places you can get at least a few cycles covered by health insurance. So I don't know if you have any additional thoughts on that.
On fertility?
Yeah.
I love Leslie, by the way. She's educated me so much on fertility. I plan to text her when that time comes if I have any questions. But yeah, I'm really hopeful about how many employers are offering fertility as a benefit. I do think you kind of have to work for the Googles and the Amazons of the world to get that benefit for the most part, but maybe again it's a scale thing. Once more people get into the space, once more fertilities pop up, maybe the price will come down. So I think, it'll just take more companies entering the space, more employers recognizing the need for a benefit like that. Yeah. And I think we're getting better at it too. I think, you can have your first child at an older age. There are many options for you now, but, getting back to the 1% of the world, you're lucky if you can afford IVF.
Yeah.
Still. So maybe one day it'll be accessible to the masses, but right now it is a luxury.
Healthcare is obviously a very emotional topic. There's a lot of heartbreaking stories that happen. And I want to know, Henry, Jody talked very passionately about where she hopes to see improvements. Where do you hope to see improvements in Europe? What are you kind of hopeful and passionate about?
For me, I could choose a disease area that I'm passionate about, something that impacts a friend or family member, but actually, I really like the reverse side of that. So I think that when we talk about emotive things and we talk about the amazing patient stories and the things that come out of health and the Vive and hopefully of Health Europe, we very often focus on the patient because that is the person suffering. But I don't think that we ever look too much at the workforce side of things. And I think that is if I have a passion and a bias, it is towards the workforce side of things. And I think when I look at some of the innovation that's happening in workforce management and planning, which sounds super dry, super dull, right? We are starting to take clinicians' and physicians' needs into account when we look at how the workforce should be organized. And in the NHS in particular, and in a lot of healthcare systems, that has never been the case. It's like, these are your hours. Like, this is what you have to do. So I think when I think about the stuff that I get quite emotional about. Yes, it is incredibly easy to hear a story about a treatment or a piece of technology that has changed a patient's life. I like looking at the other side of that and looking at how you have a workforce whose entire job is to change people's lives for the better, and technology that helps them do that and to better live their lives and to be able to provide better care is the stuff that gets me really excited.
Are there any topics that you look most forward to at Health, apart from this one? Do you have any favorites?
Yeah, absolutely. I mean, it's
Which
like
ones? Which
it's
ones?
like choosing your favorite child, though, right?
Yes, but they don't. These topics don't have emotions, so you can choose the favorite one.
No, they do, 100%. So Lena and I, but Lena mainly puts a huge amount of time into like working out what to talk about, and then I just write long, weird descriptions. That's my job. There is one session that I can't talk about publicly that I'm like unbelievably excited about setting up. I had a meeting with the logistics team about it this morning. It is smart and intelligent, and I'm terrified that if I say anything about it in public, someone will nick it. It involves AI and a very famous research paper from the late 1940s that is still discussed in philosophical circles today. I think think that's vague enough that you won't know what I'm talking about, I hope. If you do see this and you want to steal it, please don't. So that really excites me. I think that all of the stuff that we're doing on women's health with the Health Foundation, which is our sort of foundation arm, is super exciting. I love all of our workforce content. I think we're doing quite a lot because in the US we have Vive as well, which is much more focused on
Health IT.
Health IT, right? And in Europe, we just got health. So actually a lot of our health IT stuff is, I think, quite exciting. Health IT can be quite dry
You can
sometimes.
say boring.
Yeah,
It's okay.
I feel like I've replaced the word boring in my lexicon with dry, but it can be. And because Jody and her team have been doing this amazing job at Vive for a few years, we've been able to sort of not piggyback that content, but use that as inspiration to make sure that health IT isn't boring. It's not sessions.
So what is inspirational about health IT?
So you think about things like this is the dullest word in the world, and the word that I reckon turns off the most people when someone says, I reckon, interoperability is what a boring word, but it is so important. And if someone comes up to me at a healthcare event, it's like, hey, Henry, do you want to talk about interoperability? But I think I'd rather walk into traffic, to be honest. But if someone tells me or presents to me like, we've been thinking about how we can use the data that is currently siloed in the EPR to send summaries via whatever it is to this team, and then they can move the data around to this team, and it all works on digital sign-off. So before the patient knows it, they've had their test results back, and that's had input from various different clinical teams to provide a pathway to treatment. That's the story, that's the narrative. But actually the way that most people talk about interoperability is like, well, the issue with FHIR standards is don't do that. We talked briefly before this about creating narrative around stuff, creating, not hype, but finding the thing that makes people stop going, oh, it's another interoperability session, and starting to see the actual impact on the workforce, on patients, on the families of patients when stuff works. Yeah.
It's interesting that basically, I guess we don't really mention often enough how much interoperability is a human issue. Basically, two companies need to agree and need to recognize that an integration makes business sense. And that's when the connection happens. You can even have standards, and that integration might not happen if there's not a law or if there's not any business sense.
Very often there's no business sense in doing it. That's the problem. I think just trying to be diplomatic, but if you look at, let's take EPRs as hypothetical. If you are an EPR provider and you have a very long-term contract, it makes much more sense for you to build your own modules and to have them in-house, because you can build stuff that works really well for you rather than spending a lot of time on interoperability. But it arguably slows access to care and to different pathways. So I do think that there's something that needs to change on interoperability. At the same time, let's make sure that we get enough people excited to force that change, to create critical mass behind it, so that it's not just a really dull word, but is actually seen as a vital part of moving healthcare, not just in Europe or in the US, but globally forward.
So on a scale of 1 to 10, how excited are you about the European health data space?
11. I mean, when it's really well defined and it's gone through, I'll be way more excited. I'm really excited about our EHDS session at Health Europe. I can't tell you who's on it, but if you follow us on socials, you'll find out in about a month when we announce the speakers. There's a really, really interesting group of people talking about the EHDS and the potential impacts for it. So I'm always overexcited about most things. So yeah, 11 out of 10. Let's see where it goes. We'll do this again next year. Next time we come back to Slovenia, and I might be a 2 out of 10 by then, but fingers crossed I win.
We're going to very quickly move to Health Europe and some of the logistics, which I think is useful for anyone going there to know. So Health is running several networking programs, several opportunities for attendees. Some of them are an additional charge, but can you maybe talk a bit more about the Connect program, which I think is hosted by us in the US? Yeah, so can you explain what the Connect program is, who should consider it and who shouldn't?
The Connect program is something that drew me to working for health. So my background is selling into the NHS. I'm actually only 22. I just did a 10-year stint of selling into the NHS and aged really badly because it's horrendous. if someone had turned around to me and said, by the way, you can pay X euros and you can go and meet the CIO of these 5 NHS Foundation trusts, I'd have been like, of course I'm going to do that. So the idea is that for healthcare systems, so payers, providers, and pharma, the leaders or budget holders in those organizations, the people who are actively involved in making decisions around what innovations to procure, what things will help to solve their problems, can come to health for free in exchange for taking 8 15-minute meetings. So you do 2 hours of your time, and then you can come to the whole thing 3.5 days for free.
So that's for the decision makers and the buyers?
Correct.
Okay, so what about the companies? Yeah.
They get to get straight to the people who can actually make decisions around purchasing them without any faff. So I know that the ROI, roughly the ROI of without naming anyone, the first health tech products that I was selling into the NHS was pretty good, but it was really hard to articulate that to people. And you'd spend hours and thousands of pounds and constant email marketing campaigns, and you build up this giant, massive marketing team, and you've got 2 salespeople glued to phones. Actually, if someone had said to me, here's X thousand euros, you're going to go meet those people, that's the bonus. And the smartest thing about it is that all of the meetings are double opt-in. So it's not like you've got someone pitching something to a buyer that they can't purchase. It is the buyers tell us what their operational priorities are for the next 12, 24 months, however long their cycle is that they're looking at. They say, we need to fix X, Y, and Z. And the vendors tell us what they do and who they work for, and what their experience is, and then we match those things. There is a level of AI to it, but there is also a super high-touch human process where we know those people. We know our buyers really well, and we know our vendors really well, and we're able to utilize the AI that we have on the back end. That I am not a data scientist or a programmer, I don't understand how it works, but also to be able to move stuff and massage stuff into the right places. So if you're a vendor, you can fill your pipeline in half a day at health. They still have 3 more days worth of programming and content and events and things to attend and new innovations to uncover. I feel like I have probably got quite high blood pressure from selling health tech for quite a long time, and I would have much lower blood pressure if I had done that.
You are expecting 3,500 attendees at the event. How many speakers?
Publicly, that's what we're saying. I think we will go higher on that. Health's background is...
How many speakers do you expect?
300.
300 speakers, okay. And here's the last question basically for both of you. In the US, health has 10,000 attendees?
Over 12,000.
Oh, okay, awesome. And these events can be very overwhelming when you get there. They are 3 days long, but still, if you don't prepare well, it can feel like you basically wasted your time after 3 days. So what's your advice in terms of how people can prepare? What guidelines should they follow based on their own objectives to get the most out of the 3 days that they go either to this, and this can also apply to other events that they might want to go to?
I guess I would say the easiest thing someone could do is use our app. We have a wonderful event app. You can build your own personal schedule. We have a whole one-on-one Health Connect program within the app for one-on-one meetings. So you can search through other attendees that are attending. You can send them messages, meeting requests. You can book the location for the meeting. So I would spend the week before going through the agenda, saving sessions, booking meetings.
Only a week before? That's late for me.
Yeah,
it's
for the agenda, a week before is okay.
Yeah.
For the meetings, you should probably get a head start because people are getting lots and lots of requests. But yeah, I think just don't leave it to the last minute. Make sure you know from the beginning of your day to the end what events you want to attend, what lunches you want to go to, how early you want to show up every day, and really stick to that schedule because things will pop up. And then you'll have serendipitous meetings in bathrooms and bars and lounges. And so there's always room for that. But I think sticking to your schedule will probably be the best way to have an ROI in your time.
Yeah, definitely. Prep. It's exactly what Jody's just said. No one wants to talk about it, but spend some time beforehand working out what you want to get out of it. Work out what your objectives are. If you're there to meet people, as a podcast host, you'll want to meet brand new speakers and exciting people to interview, right? I'm sure that you go through the speakers list and you're these 5, I have to get time with these. Work out what your objectives are for it, and then spend a little bit of time, because you're investing your own time into this, your money into it. It would be odd not to prepare for it. So prep.
And we do our best to personalize the experience for certain attendees. So we have different personas, and it's all on our website. So, for example, if you're a head of benefits, you can go to our employer page, and see the sessions that we recommend for you, the programs we recommend that you be a part of. And if you're still confused, reach out to our team, because we'd be happy to suggest things. That's where I think the events industry is going, highly personalized agendas for each and every attendee. Even though we have 12,000 of them there, we want them to feel like we really put in the effort to make sure that they individually had a great time. So
speaking of great time, I didn't ask, but one of the very significant parts of health in Las Vegas are the evening receptions and parties. People love them, people criticize them. Why are they important? How do you see them?
We're a community. So we want to build this year-round community. We want people to run into old colleagues, old friends, meet new friends, and what better way to do that than listening to great music, having some food, some drinks if you choose to, and creating this fun environment. I don't think because we're a healthcare event, we need to be a stodgy, boring conference. People are spending 4 days out of their year with us. Let's show them a good time. So I think, there's no harm in a little fun.
It's exactly the same for Europe, right? Look, I can completely understand why people might criticize them, but actually so much of exactly what Jody's just said, so much of what we do is about creating community, creating network. And you can absolutely do that within the confines of a venue, within the confines of Rye in Amsterdam or one of the venues in Las Vegas. Yes, you can do that. However, once that finishes, what we want to do is ensure that that community kind of has the chance to interact in different ways, that isn't in a roundtable discussion or on a panel or watching something or going through all the amazing innovations on the different stands. It's by sitting down somewhere comfy and talking about what have you seen that's interesting or innovative today? That's a really good way of people being able to share the things that they've learned in a much more natural environment than a LinkedIn post or a formal meeting.
You actually gave us a really good icebreaker recommendation for everyone that are going to go to Health Europe. So Jody, Henry, thank you so much for taking the time today and sharing everything.